Hello, everyone. My name is Mike Laidlaw, and I'm an operational consultant to Novus Health Systems. With the recent passage of H.R. 1 and its potential impact on Medi-Cal and Medicaid, we feel it is essential to be as efficient as possible when it comes to managing your Medi-Cal and Medicaid receivables. To that end, we have a very timely and comparative webinar that represents the contrast between manual and automated practices that impact your financial operations. Today's webinar will be presented by Jonathan Heath, Senior Vice President of Business Development for Novus Health Systems, and Perry Beck, Director of Operations for Novus Health Systems. They'll be presenting some of the current state versus future state opportunities when moving from a manual to automated process. And with that, I will be turning the program over to Jonathan and to Perry. Jonathan?
Hello, everybody. Thanks for joining us. We appreciate it. I will mention that we've allowed you to be able to unmute. We'd ask that you mute your personal devices so that we don't hear background noise, but you can feel free to unmute during the presentation and ask a question if you wish. There's also a chat box where you could put questions in, and we will address those at the end of the presentation. So with that, we'll get going. Novus started 20 years ago working Medi-Cal and managed care receivables for hospitals. The inefficiency of too many paper forms and too many repetitive manual tasks was very clear. We started looking at workflow disruptors so that we could automate to eliminate steps and improve accuracy. Today, we're going to look at 5 of these disruptors and compare how they are done without automation to how we address them with automation at Novus. Our goal today is to show what's possible and to recommend solutions like this be introduced into your workflow. The benefits are remarkably valuable. So as you can see, the agenda, the 5, we've done introductions. The 5 disruptors we're going to be looking at are locating and working with remittance advice information, CIFs and Appeals, checking eligibility, tracking TAR and SAR status, and sourcing current code information, for that's accurate, timely, and informative. And unfortunately, it's available in a lot of different locations. So how do we deal with that disruptor? So then we'll have final takeaways, and then again we'll address those questions that are in the chat box. So I'm actually going to kind of combine the first 2 disruptors because they kind of go hand in hand. The first one is locating remittance advice information. I consulted with our experienced staff here on what the manual process without automation looks like. They've fortunately been able to use the automations that we've put in place and tell me all the time that they feel spoiled by that. But I asked them to explain what it was like without them. And normally I'm a fan of keeping presentation slides clean and simple, but I went ahead and listed all the manual steps for all of these disruptors because I want to make a point. There are many steps, they're repetitive, slow, and sometimes they can allow for inaccuracy. So as you can see, for looking for remittance advices, you have to go through the login steps in the portal, select your organization and your NPI number, choose the transaction center. Then you have to choose the remit that you want to look at. You have to know which one you're looking for that'll contain the information you're seeking, or make educated guesses where that information would be until you locate the right one. And I should actually pause here. That was sort of previously with the Medi-Cal portal. It's going to get more complicated. They used to put the last 6 remits up in the Medi-Cal portal. Now they're switching to only 1 at a time. So it's going to become, harder if you're not gathering that information on a regular basis, which is something you'll see that we automated. You need to download the remit document, which can take some waiting depending on the size. And then you have to use some kind of manual searching, control find, locating patient name or account number or something like that, and tab through until you find the precise RA, and then repeat it for the next inquiry. So that's just locating RAD information, and not really even there's not really an opportunity to even do much with it. You'll see that we've addressed that as well. Preparing CIFs and appeals goes hand in hand with that because you need that remit information to prepare CIF and appeal documents. For the most part, there are minor exceptions, but for the most part, those still require paper forms for Medi-Cal. So having those forms on hand, that's unfortunately something we can't get around either. But you've got to locate the remit that you need to do the CIF. And then typically we're finding most providers are preparing these CIFs or appeals using a Word or PDF template, maybe an Excel template. Some still handwrite them and cell by cell fill in the information. That information is viewed on screen or on a paper document and transferred manually, which is prone to typos and human error. You can see all the types of information that have to be typed in, and if it's a multiple line CIF, it can be very, very onerous task. Add your remarks, align, print, and mail, and then repeat. If you're sipping something for the same reason, you've got to type it all again or cut and paste it. Any errors are going to cause delays and require redoing this. And then, of course, appeals are a very similar process. So we found the average time to prepare a CIF or appeal is around 12 to 15 minutes, whereas with the automations that Perry's going to show you that we put in place, you can do it in about 3 minutes. So with that, I'm going to turn it over to Perry to show how we automated the remit and CIF and appeal processes.
All right. Okay. Well, the remits process starts on Monday when the legacy file is available from Medi-Cal to import. And it starts with pulling them into a central repository so that they can all be accessed and viewed on a weekly basis, including the actual hard copy RA that's available on the Medi-Cal website. I'll show this right now. So all of this can be stored, and it's important to store this for auditing purposes and having it all organized and together in here. But to locate specific remit records that span the back to the beginning of time here, or however long that you have the remits in your database, starts with having a single searchable database that you can use to key in certain criteria. So the nice thing about having everything in a single searchable database is that the matches can connect with multiple remits over multiple dates, and then with some automation as far as like tooltip technology, you can have the claim type appear, outpatient or inpatient, what type of claim was submitted to Medi-Cal, including the RAD codes, and this information is available from the Skippy file. So you can just hover the mouse over and very easily and automatically have all the information presented to you as far as the CPT code description, the maximum allowed paid, have this all information on the fly, and what type of adjudication it was, denial, payment, suspend, record. And then tagging, selecting, and immediately printing it in multiple different formats, having it in a format that's in a follow-up type format where only the patient that was tagged is presented, as well as a key code for the RAD code so that your follow-up team knows exactly what to do. Having a hard copy version of it is important because if you want to just see the page inside the RA that it appeared on, as well as all the other patients around it, perhaps there's some kind of pattern that can be identified. This allows that to be done. And this is also the format that Medi-Cal insists upon when submitting CIFs and appeals. And then having a hard copy blocked. This format blocks out everything except for the patient that was selected, and this is a process that saves a lot of time at the Xerox machine that we implemented, and again, if it can be done programmatically or automatically, it's preferred so that it saves time, it saves steps, so that billers, users can get to more work in less time.
One of the things I'll chime in here and quickly mention is in automating some of these things, not only does one idea uh, breed another idea, but we're also able to create documents or resources that don't exist anywhere else. Like the first one that Perry showed with the RAD codes at the bottom, the follow-up version. Those are things you can't find anywhere else, and so we've been able to make tools here that we can use internally or that a client can use that don't exist anywhere else.
Right. And having everything in here also allows for data mining. There's an advanced search feature, and this allows for users to specify criteria, date ranges, RAD codes. It's nice because certain RAD codes need to be worked in a specific way and differently, and work queues can be created, lists. And this allows for that type of data mining and is important when harnessing all of your remits in a single area. The next step involves an integrated process with the CIF and Appeal templates. As Jonathan pointed out, some people, a lot of providers, and surprisingly out there, have kind of fabricated their own CIF and Appeal templates out of Word and Excel documents. That allows for a lot of human error. It allows for multiple steps, a lot of keystrokes and typing. So since the CIF and Appeal forms depend so much on the data from the actual remit, we decided to integrate that with the remit process, where you tag an RA and through automation can have it all appear automatically in the fields of the CIF template. Or then all you need to do is type in the unique information such as document number and remarks.
And I'll mention here, Perry's using an example of a CIF that only has 2 lines. That already is a lot to type. Imagine if you're CIFing something that has 7 or 8 lines, you have to type all of that. It gets even more difficult. So this makes things a snap.
Correct. Every one of these characters would need to be manually typed up at the top. So you don't have to worry about that. So cleaner claims, cleaner CIFs and appeals, fewer denials. And then once and if you're doing multiple CIFs for similar reasons, this happens all the time. If you're doing takebacks, 10 or 12 of them, and you can structure the remarks a certain way, and it just needs to be changed slightly for the subsequent claims, there's a button, and through automation, you can have all that text change from the last. It automatically copies all the text from the previous claim into the remarks for the current claim you're working. So this saves a lot of time and steps as well. And let me just go back and demonstrate these same steps for the appeal process. So just as easy as switching back, toggling back and forth, you can do the same thing with the appeal. Select the remit, type in the document number, start typing remarks. Don't worry about all of the RAD code, the claim control number, all this information that has potential for human error. And then once the claim forms are sourced and prepared and printed and submitted out, and if they're saved in our database, then having the CIFs and appeals all in one area does allow for additional automation, and that is checking status once they're out the door. And this can be done by nightly process, some steps to go out and pull in, say, the appeal letter that pertains straight to the appeal form and have them all joined and connected. Saves a lot of time having to do this.
Person using this can come in in the morning with get their coffee and sit down, and they know exactly which of their appeals have responses.
Right. Like if the information's already in here, why not leverage that and utilize it and save a lot of steps going out to the Medi-Cal website, navigating their screens, have it all just located right here. So that's the remits, CIFs and Appeals, and with that, I will turn it back to Jonathan.
Okay, so the next disruptor is normally handled in the Medi-Cal portal, and that's checking eligibility. Roughly 1/3 of Californians are on Medi-Cal. It's a lot of people, and it tells you this task is constant and very important for providers. It's essential to get that eligibility information. So it has to be done. It takes up a lot of time and resources to check all these eligibilities. Again, you see the steps here, very busy slide, logging into the portal and getting to your organization in the transaction center, choosing single subscriber, and then manually typing in the information you need to search. Now, while we can't avoid some of this typing, what we've been able to do in our automations is eliminate some of the characters you need to type or eliminate fields that are unnecessary to fill in. Perry's going to show you that. But then you have to wait for a response on each one. And of course, those responses are not automatically saved. So it requires screenshotting it, naming it, and saving it, which is something that very organized people probably do, and people that maybe aren't so organized don't get around to all the time. So it's hard to find later. We thought, why not have a system that just saves it automatically? So it's a very one-by-one routine, manual routine. Again, we saw this as an opportunity to automate, and I'm going to have Perry show you that now.
Okay, just clear the deck here. So yes, having the ability to perform eligibilities, retrievals within the same application allows you to do additional tasks. Now, retrievals can be done in a couple of different ways interactively, which I believe is probably what's done most often, but it can also be done in a batch. I'll just quickly show the batch process. So if, and this is important too, because as Jonathan mentioned, with 1 in 3 Californians on some form of Medi-Cal, quite a few patients coming in that are supposedly private pay, self-pays, end up having Medi-Cal. So why not export and generate a list of all your private pays and use this batch process to bounce everything off, all the socials and the database, date of birth and service dates against the Medi-Cal website and see what hits. Then you can move those into proper financial class codes. And then everything is stored in the transaction history area. Let me just go to interactive here real quick and demonstrate what can be done. I'll just put in some random information here. So when you're performing eligibility checks on the Medi-Cal website, they tend to have you type in information into fields that don't need to be typed. So we've eliminated some of that, such as the issue date. We've also implemented some features that you don't have to type in, say, the century, and that's important. I know it's slight seconds, but like right here, if you hit tab, I just hit 1963. These are important because if you're doing, as we do, a lot of high volume and you want to get through a lot of productivity, this is the way to do it.
Yeah, I always say when someone's looking at these automations, the idea behind it is eliminating manual steps. Some may save seconds, some may save minutes, but if you sort of close your eyes and think about what you do every day and project those out over hours and days and weeks, you're talking about an enormous amount of time and energy saved and resources saved when you combine all of these different things that we're showing you. And what they do in terms of adding efficiency.
Right. It's also important to have like immediate response as far as like whether it's green light or red light if you put in wrong information so that you can correct anything. What's also helpful is that with this automation, you can switch months real quick. I just checked the October. I'm going to check November. I'll check December. And you can put them all on a list, and all of that can be printed out into either an Excel spreadsheet or PDF that contains the eligibility response printout from Medi-Cal.
It's also notable, unlike the website, you can actually type in a search and start your next search while you're waiting for the results to come back. So again, no sitting around.
Correct. All of these printouts are saved in the transaction history area, and that's important because Medi-Cal only allows you to go back 12 months as far as the service date. You can't check eligibility that's 14, 15 months out. But if you can check it and have them all checked in here first, they're saved indefinitely and can be used later on down the line in conjunction with CIFs and Appeals, which is important.
For
now,
audits?
What's that?
For audits too?
For audits too. Now, if a share of cost is detected, there's an additional feature and that can be done by having the eligibility task handled on the same application here. Let me just demonstrate this. Putting in the information, hitting retrieve. When the system detects that there's a remaining share of cost, a little clear button will appear under the SOC, share of cost column. Click the clear button. A window appears. Type in all the information into the requisite fields, and those fields have been arranged and organized in a way that is efficient so that you can type that in, hit submit, and the transaction and all the steps involved with clearing the share of cost. In this case, it looks like $1 cleared. And you can see that the remaining is now $376, $1 less. So both the original eligibility as well as the confirmation of the spend down obligation process is all preserved, as is demonstrated. That's the before shot, 377. Here's the after with the spend down response printout. And all of this is stored in transaction history. Let me just back up. For your entire team. So it's important that everyone can see each other's work as well. If there's customers providers that have their admitting departments just constantly checking. So everything is all housed in one area here and can be accessed by anyone in the organization. So with that, I will turn that over to Jonathan.
Okay, so next up, our fourth disruptor is checking TAR and SAR status. Once we developed eligibility, which is, again, it's a portal activity, we saw how similar efficiencies could be migrated to other tasks like checking TAR and SAR status. Of course, that involves another portal too. So again, another example of, aggregating information or tasks into one application was useful for us. So you can check your TAR status, which is the Medi-Cal portal, and you can check your SAR status, which is the CCS portal, all in the same place. Again, very similar steps were involved, so it was easy to sort of develop this, and I'm going to have Perry demonstrate that.
Okay, yeah. The TARs are a creature of the Medi-Cal program, and SARs are of the CCS program. Now, through automation, you can it's helpful and very beneficial to have all the TARs housed on your side locally, so you can perform searches, check the statuses of them. Now, ETARs are received by Medi-Cal every day, so having a daily process to pull in all the brand new TARs and have all of those housed in one area, as well as the SARs from the CMS Petty CCS website. And if that documentation can be housed in one area, it allows for individuals to check status on all the SARs and TARs that are pulled in. And have all these records on hand and available to be dealt with. So 2 different databases, all your authorizations. You can check all your pending auths and move them out of the pending queue and into a billing work queue. With that, I will turn it back over to Jonathan.
Okay, so the last disruptor we're going to talk about, we addressed with automation the simplification of searching for various types of codes, NPI numbers, and other information sourced from numerous locations. We used automation to aggregate this information into one convenient place to make sure it's complete and up to date and completely accurate at all times, and very informative, easy to search, easy to look at, and as you can see, if you do this manually, you're talking about different manual steps on different websites, often different logins. Transferring this information to your claim or follow-up document, again, requires manual typing or cutting and pasting, allowing for human error. Is the source being used the most accurate and up-to-date source? Can you easily repeat a lookup, or is information stored for future easy access? It's a step-heavy manual process. So having it all accurate and at fingertips seemed like an ideal thing to automate. So we created a code finder, and Perry's going to show that.
Okay, here we go. Yeah, the code finder. In this business, everything is codes. So many codes, and not enough time to keep up with everything. And then there's codes that need to be integrated with other codes. So we created a code finder, a single area where there's multiple libraries that can be just with an easy click. With automation, you can have all of these codes checked and updated periodically. Right here, we are looking at the Medi-Cal, the CPT codes as they pertain to the Medi-Cal program. So having this handy is whether you could quickly look up a code and see if a TAR is required, see what the effective dates are, whether it's valid in the Medi-Cal program. Over on the far right, a Y or an N, that's helpful because the Medi-Cal managed care outfits, health plans are supposed to abide by these, so it's good to have this information as well as max allowed paid. Let me get something. All the information, as opposed to having the Medi-Cal website to go to for all of this, have it all in one area, and then you have access. As well as the CCS, the grouper codes, the SCG codes, having that all in here and having a little tooltip feature that you can mouse over. This was a challenge, kind of combining it. This does not exist. There's no such list that exists that we could find that has the SCG codes married with the CPT code. So this was, again, something that was developed in recent times here at the request of providers out there that said, hey, to help us eliminate additional steps, can this be done to integrate that? And we went to work putting that together. So there's other code tables, the diagnosis codes, NPI codes. NPI codes are pulled in from the NPPES website. So you can either go to the NPPES website every time or have everything periodically pulled in, all millions of them, and have access to all that information on the fly here. And again, we was able to integrate other information and put them in there. Section 4 is DRG information. This does not appear in the NPPES website. This was implemented and developed at the request of a provider customer that wanted to see that information. And then another provider customer wanted OIG exclusion and PACO certification cross-checked every NPI because their admitting departments needed to check that. So we kept expanding this until it became kind of a proprietary draft, and that could actually benefit not just the business office and revenue cycle, but also admitting, which technically is part of that, but multiple departments. So with that, I will turn it back to Jonathan.
I just want to reiterate again the way Perry was showing the code tables. Again, we've been able to create documents or resources that don't exist anywhere else, so that serve our purposes and also our customers' purposes. We have our own ideas that breed new ideas, and then we have customers come to us and say, hey, could you automate this? Could you do that? And we've sort of kind of mastered the art of doing this so that there's constant updates to what we're automating and how we can make things more efficient. And those benefit, us and everyone that uses our platform. These are just 5 areas of many that we've improved with automation. We've developed many more, and we continue to implement suggestions and new ideas, like I said. We've seen providers implement different levels of automation over the years on their own. Some use it only for posting RAs, posting payments or adjustments. And while it's, while it's absolutely beneficial to do that, we feel that is the most basic approach. There is so much more that can be done leveraging automation and available data. We originally built the tools we showed you for our own use, but over time we have had over 150 California hospitals, including some of the largest health systems in California, see the value of making our automated processes available to their follow-up teams. And they're getting 3 to 4 times more work done with the automations than they were without it. It adds accuracy, which means money comes in faster. It frees up resources, which they can reallocate to other important tasks. For example, financial classes that reimburse more than Medi-Cal. With the changes on the horizon, there's no better time to maximize efficiency while minimizing use of resources to bring in your Medi-Cal managed care dollars. No matter what the changes are out there, you're still going to have Medi-Cal patients, and you still want to get every dollar in the door in the most efficient way possible. Automation is a perfect solution. Today's presentation was to show was for the purpose of demonstrating the power and possibilities associated with automated processes. If you'd like to see more of our platform and how it can benefit your organization, please contact us. My information is on the screen. There's certainly a lot more to show of things that we've developed. With that, we'll take any questions that anybody might have.
So, Jonathan, we have not received any questions through the chat room.
Okay. Okay. Oh, wait, a question just came in here. Someone actually, when you were showing the code tables, Perry, they noticed something about Medi-Cal news and wanted to ask about that.
Oh, yes.
It's flashing.
Part of automation, we have a news feature here. Medi-Cal puts out the latest news bulletins, APL for managed care letters, EPC letters, and if it's flashing, that means something hot off the press came in from the Medi-Cal website. So all of that is stored, news going back, stretching back a few years, and anything can be, any information inside the body content of these letters that are put out by Medi-Cal can be searched for in the keyword search area up here at the top. So if you're doing a deep dive on certain CPT codes and want to see what the Medi-Cal program has put out, any correspondence, this can all be done in the Medi-Cal news area.
Okay, and I have one more question. Going back to the part of the platform where you were showing remittance advice, Medi-Cal remittance advice, someone is asking, they saw something about Medicare there and wanted to know what that was.
Yeah. All of the remits we've put in, remits are either Medi-Cal fee-for-service, Medicare fee-for-service, and commercial. Commercial is kind of a catch-all. So to streamline follow-up processes, we wanted to run all of the 835 files, electronic remit files, in through a single system that can put, say, the Medicare remit in a format that Medi-Cal accepts. So all of the remit formats and functionality is such that it can be processed and by Medi-Cal and not be rejected for incorrect format. Let me, for instance, well, okay, wait a minute. This is the trying to find when. Okay. For instance, Medi-Cal insists that the Medicare RA, when processing crossovers, needs to be in the national standard format. They also have another rule that if there's more than 15 charges on the Medicare RA, you have to cut it off and make it put it on multiple UB claims. So there's a feature that's been put in place called 15 charges right there. So we wanted to make it so even it's helpful through automation to have a special feature that can put your remits for secondaries in a specific format that makes it payable to the additional payers. And right here you can see that it counts 15 charge lines and then slices it off and puts all the header information on the next page as well as the remaining charges. Same with commercial remits. We put that into a standard format, and along with all the advanced search and data mining capabilities that come with the Medi-Cal area and Medicare area. It's important for the commercial, because with 1,000 different formats from a whole bunch of payers out there, we wanted the data to be such that it didn't cause denials for missing information. That was a major cause of denials that we have noticed and other providers have noticed. So to have a uniform standardized print format for any kind of commercial insurance RAs was beneficial to not only to look at the same place and have the information always at the same location on the form, but also to prevent denials. Anything else?
So I think, you can see the ramifications or the ripple effects of all these automations is, more efficiency, more accuracy equals money coming in faster. It snowballs. So I actually don't have any other questions, Perry, but if you want to throw up the question slide just to re-show our contact information.
Sure.
Please, anybody who has any further questions about this webinar, or interest in seeing more about our platform, you're welcome to contact us. Medi-Cal questions in general, we're always happy to field those. We've been sharing our expertise with providers in the state now in the Medi-Cal managed care area for 20 plus years. So we appreciate your time today. Thanks for joining us, and have a good afternoon.